بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. Hello everyone, welcome again to Ziada Academy, and today I will talk about another cause of the painless red eye and last of differential diagnosis. In the last lectures, I talked about the subconjunctival hemorrhage, episcleritis, and then the infective conjunctivitis. Infective conjunctivitis, either viral or bacterial, and I talked about the different kinds of bacteria, starting from the bacteria causing mucopurulent conjunctivitis like Haemophilus influenza and Staph aureus. Then the gonorrheal purulent conjunctivitis caused by the Neisseria gonorrhea and its relation to the genitourinary tract infections, also the chlamydial infection, including the chlamydia trachomatis and chlamydial conjunctivitis, the acute and the chronic stages of the chlamydia infection with what's called trachoma. Then the other causes of the purulent conjunctivitis. Today I will show another cause of the pink eye or painless red eye, which is the allergic conjunctivitis. Allergic conjunctivitis, it's common cause of conjunctivitis, especially in individuals with history of atopy. And the atopic patient, which is allergic to certain circumstances like season, like environment, and so it's a seasonal presentation or related to specific season or specific exposure to environmental factor. It occurs when exposed to allergen like pollen. Typical conjunctivitis symptoms, including itchy eyes. You have to emphasize on these presenting symptoms: itchy eyes, swelling of the eyelids, and conjunctival, it's called chemosis, and associated coryzal symptoms, flu-like symptoms. So this patient may present with the same symptoms of flu-like symptoms like the influenza. Because in the atopic patient, you will find that the allergic conjunctivitis is associated with allergic rhinitis, and they may be associated with allergic bronchial reaction. So it's common presentation with the different kinds of allergy. So there are variants which can occur year-round with unclear precipitants. Management includes cold compresses and oral antihistamines for mild cases. Face washing after exposure to allergens is also helpful, so I recommend and advise. I usually advise my patients to wash the eyes and wash the face with the cold water many times during the day, so it feels better. So they will feel better with these cold compresses and repeated washing of the face. Topical antihistamines, steroids in the severe cases, and mast-cell stabilizers as long-term therapy. But here we have to know the allergic conjunctivitis is not the diagnosis of exclusion, because I wonder if I see that many prescriptions from ophthalmologists may include steroids, antihistamines, but the patient has no signs of allergic conjunctivitis. So it's not a diagnosis of exclusion. You have to find to hear the symptoms of allergic conjunctivitis from the patient, and on examination, you have to see the signs. The signs is papillary conjunctivitis, as shown in the figure down in the figure in the bottom of this slide. This is papillae. There's conjunctival papillae, which is diffuse on the palpebral conjunctiva, as you see. If you didn't find this papillae, so it's not allergic conjunctivitis. Okay, the second is conjunctival chemosis, as shown in the middle picture. This is the conjunctiva around the bulbar conjunctiva around the cornea is edematous and bolus. It is called chemosis, conjunctival chemosis. And in the upper picture, you will see the red eye swollen, a little bit swelling of the eyelids, also the pink appearance of the eye, and the patient is feeling burning sensation and itchy sensation, and it tends to rub the eye. So all these symptoms and signs should be provided and should be seen and should be present to diagnose allergic conjunctivitis. So about the treatment, there is a conservative treatment, like trying to be away to avoid the allergens, to avoid the triggering factors and the precipitating factors, either environmental or others. And at the same time, the medical treatment, like the antihistamines. We have to start with the antihistaminics first. Please save the steroid therapy for the severe cases, and if the antihistaminics were not enough to treat this problem, don't start with the steroids. And when you start with the steroid, when you like to start with the steroids, start with the weakest steroid, which is fluorometholone. Don't go to the prednisolone or dexamethasone directly, because they are potent drugs, but you have to save them for the severe cases because of their side effects, which may happen. Especially the patient, when feel comfortable and feel better with these drugs, he may repeat. He may use them for a long-term therapy without advice, without supervision of his or her doctors. So they may have the side effects of the long-term therapy with the steroids, because it's magic drugs. Steroid is a magic drugs. It will relieve the symptoms and signs within few days. So the patient will like them and like to repeat them and to reuse them again without going back to taking the advice of the ophthalmologist responsible for treatment. Okay, so my notes here. One of the common causes of painless red eye is the allergic conjunctivitis, and you have to find the symptoms and signs to diagnose. And you have to know that the standard treatment is the cold compresses, the washing of the face many times during the day, especially in the outdoor time, by the cold water, not the hot water. The antihistaminics are the standard therapy, either systemic and topical by eye drops. Then in the severe cases, you may use the steroids and mast cell stabilizers to keep a quiet eye during the certain season. I hope it's clear now for all of you. Thank you very much, and see you in another video with another cause of the painless red eye. See you. Assalamu alaikum wa rahmatullah.